So, welcome to this week's Optimum Health Clinic Facebook Live. And this week, I think it's going to be the first in probably a series of videos. Jenny, who looks after our social media and newsletter and various bits, had an idea of doing an AMA. And for those who don't know what an AMA is, it's an Ask Me Anything. So it's basically where you guys can post questions. And I think there's a thread going on the Optimum Health Clinic Facebook page and the Optimum Health Clinic kind of Facebook group, where I think there's a whole bunch of questions that have been building up, which he's kindly posted into a Google Doc for me. So I think it's fine to continue to add to those questions. I'm pretty much at the moment planning on just going through them in the order that I can see them on the document. Some may be more appropriate to answer in this context than others. What tends not to work well is questions which go to kind of detailed on a specific kind of case. But if they're kind of more generic questions and within reason, I'm happy to answer them. There are some which I think I've done previously in Facebook Live, so I won't kind of repeat myself. But I think there's quite a lot more here than I'm going to be able to do in one video. So I guess I'll probably do the first 3 or 4 or so. And then I think what I'll do is, rather than just do lots of these one after the other, I might do a few of these and then do a few other things, and then we'll kind of come back and revisit. So the first one is, can you explain the connection between not getting colds and having ME? This is from Sylvia. I've seen a few posts on here about getting a cold potentially being a sign of being recovered, based on something Alex said once somewhere. But I don't think we've ever had concrete confirmation of that. So Sylvia, the kind of logic around this is that for a lot of people, but not all people with ME chronic fatigue, one of the things that you see is an overactivated immune system. And the reason why that is because of maladaptive stress response. So it's a little bit like the immune system and the nervous system are overactive. So you find that just like you're sensitive to light and someone might be sensitive to light and to sound and to stress, and the doorbell goes and the kind of nervous system jolts, you can see the same thing in the immune system. So you see that people can be more sensitive to foods. They can be more sensitive to chemicals. They can be more sensitive to different kind of things that are in the environment. And it's a little bit like pre-September the 11th, and someone would leave their kind of gym bag on the London Underground, and no one really paid much attention. And there was a kind of whole thing about having people being aware and looking out for suspicious packages, and will you please report them? And then for a period after September 11th, living in around London at the time, it was kind of interesting to notice that someone would leave something by accident on a tube, and like the whole tube network would start shutting down, and people would start panicking. And there was one could argue, somewhat disproportionate reaction to a relatively minor thing that had happened. And there was a kind of assumption that everything was a bomb and everything was something that could be dangerous. So when we have maladaptive stress response, and we have this kind of ramp up in the nervous system, and we find that we're hypersensitive, we tend to have the same thing in the immune system, as I say. There is a positive to this, believe it or not, which is that because the immune system is so kind of overactive, we are less likely to get colds and flus and the kind of various kind of bugs that go around, because it's like our system is on the watch and on the lookout, and it's kind of responding to everything that's there. So we get less of those things, but more of the kind of hypersensitive reactions. Now, this is not true for everyone. There are some groups, particularly where there's kind of viral factors that are going on, people find they go down with everything. So this is a good example of subgroups and the differences between different cases. But if you're somebody that never seems to get colds and flus, then actually a sign that the nervous system and the immune system are rebalancing is that you have less of the sensitivities, but you're more likely to get a cold or a flu. And it's considered fairly normal immune function once or twice a year to catch catch a cold, and to be completely laid up with flu for a week or two is a bit less usual. But to catch a bit of a cold from time to time is not a bad thing. It's kind of a healthy functioning immune system. So that's the reason why. It's basically calming down a maladaptive stress response, rebalancing of immune system, less overactive, and therefore responding more appropriately. So the next question is Janet's question, which is, what's the difference between maladaptive stress response and CFS being psychosomatic? This is a great question, actually. And it's one of those ones where I always feel very mindful of talking about the role of psychology in ME chronic fatigue, given how easily that can be misunderstood and how easily that can be turned into being something that it's not. So there are different ways that one might define psychosomatic, but the way that I'm interpreting the question, I think the way that the question is intended, is almost like something which is not a real symptom, but it's being generated by the unconscious in a kind of imaginary way. So for example, phantom limb pain. Somebody has a limb removed, and maybe they have an accident and they kind of, they get a kind of diabetes kind of roll-on reaction situation and have a leg removed. And then 6 months later, they're having leg pain where there's no leg. That's psychosomatic. There is no leg to have pain, but the pain is still a legitimate experience. So in that situation, there is no physical thing that's wrong. What there is an unconscious kind of sequencing or patterning around something, which is acting as though there is something, and it may be a very real experience, but it's not a real thing. With maladaptive stress response, what we're talking about is an overactive nervous system, so sympathetic system over arousal, which is then causing a set of outcomes in the body. And that could be anything from what I talked about in the last question in terms of ramping up the immune system. It can be affecting digestive function. So we're not absorbing food as well. We're more likely to have candida, SIBO, those kind of things that are going on. We are draining our adrenals, our thyroid, and our endocrine function, which means that we're burning up our reserves. That means we have less resilience. And if our mitochondria are not functioning properly, we also then haven't got a kind of a reserve tank to draw upon. So with maladaptive stress response, there are actual real physical factors that are happening in the body. They're not like phantom limb pain, which is kind of a kind of unconsciously created thing. They're actually measurable changes in the system. We can measure digestive function. We can measure adrenal function. We can measure mitochondrial function. We can measure the immune system. So we can actually see the consequences of that maladaptive stress response. Now, I would have a significant challenge against anyone that says that all ME chronic fatigue is simply maladaptive stress response. And there are theories out there, they might not call it maladaptive stress response, but we'll talk about kind of overactive sympathetic nervous system as being the only factor. I don't believe it's the only factor. I believe it's one of many factors. It's often a key factor for many people, but there are lots of people that you calm down maladaptive stress response and it's not enough to facilitate recovery. But it's often an important piece. So yeah, that's really the difference. The difference is that we can measure real things that are happening, and they may be happening independent of maladaptive stress response. It may be the primary thing causing those things. It may just be something that's blocking or slowing down the recovery or the healing of those things. I have no idea. Well, I didn't set a timer at the start, so I guess I'll do a few more. I have no idea how long this video's been so far. So next on my list is an update on the trials we're doing with university, and would be good to know if there's any news. There's lots of news that isn't really news that's yet worth kind of making public news. I think the headline that I would say is that getting ethics from the NHS to be able to treat NHS patients using our approach, so a functional medicine and psychology combined approach. It has been an enormous undertaking. I think we're at about 1,000 pages of documentation. multiple meetings with ethics committees. And, it's probably the hardest step of the whole research process that we will ever have to do, is to get that ethics approval. Because what they're basically saying is, we believe that your approach is safe to be administered to NHS patients. And that's a significant leap of understanding if you consider going to your GP and saying, I'm going to the Optimum Health Clinic, what's the response that you would, in an average case, that you would get, despite the fact there are GPs that would strongly recommend people go to Optimum Health Clinic. So that process has taken a lot longer and been a lot more challenging than we had anticipated and the university had anticipated. We seem to be close to the end of that process. I hope to have an announcement in the coming months. I would like to say the next few months, but I know that there's been a number of times we thought the next few months, and it's been another year has passed. I will go as far as to say that the speed of process in academia and research is quite painfully slow. And there's a reason why people don't do this kind of research, because it's really, really hard and difficult to go through the process. It will be the first combined functional medicine, nutrition, psychology study to get NHS ethics that I'm aware of. So it's a significant undertaking. It feels like it's going to be a pretty kind of much easier path, let's say, on the other side of that. So I appreciate, for those that have supported our research to this point, it may have been, there's been kind of radio silence, and it might have been kind of frustrating at times. We're just waiting to get to that next major milestone, at which point we will obviously communicate that we've got there. Let's do one more. Alex has talked about the achiever subtype and the helper subtype, and said that we need to find our self-esteem in something other than achieving or helping. I'd love to hear any ideas of how to do this. I have touched on this a few times in other videos where I've talked about the subtypes, but I haven't done this in a lot of detail. And I wonder, I hadn't prepped these questions very much in advance, so I wonder if this is actually, I can kind of warrants its own Facebook Live. But maybe what I would just say as a headline is really, it's how do we know ourselves? Like, how do we define our self-worth? And often we will do that by the things we do, the things we achieve in the world, and in a way that can be measured and seen by others. And the problem with that is, if we can't then keep up with those achievements or those things, then we don't have self-worth, because if we're defining it by that. And without wanting to get into too much into kind of depth psychology and kind of developmental theory and stuff, there's a place where we have self-value which is not dependent upon outside things. And it's more of a sense of knowing ourselves, not so much in our mind, in our ego, in our kind of doing, but it's knowing ourselves more as a kind of grounded, connected being. It's like knowing who we are in our heart of what we love to do and what we're passionate about, as opposed to what other people kind of think we should be doing. And that's kind of a process of breaking those patterns and seeing through those achiever patterns, those helper patterns, and kind of seeing what's there when we're not doing that. So it's kind of having a deeper grounded connection to ourself. And the more deeply we are connected to ourself, interestingly, the more we're also connected to our own innate sense of self-love and self-worth. It's like, if you look at a baby or a child, if they haven't got a lot of conditioning, they don't worry about screaming or shouting, or they don't need permission to do that. That's something that comes in later as the inner critic or the superego and the kind of layers of personality kind of start to get structured around that. But there is, the kind of innate sense of their worth is there. And that's not, it's a challenging question to answer without going into a lot of complex theory here. I'm not romanticizing being a child. I think that's a fallacy that can happen in psychology, that actually, there's lots of capacities that develop as we grow up that are fantastic. And it's very easy to go, if we were all just like children, we'd be great. If we were all like children, there'd be nuclear war very quickly. But there's a there's a sense of being connected to our own innate value and self-worth, which is not dependent upon doing an activity. But we only get there by breaking those patterns and deepening our connection to ourselves, because that's a feeling of self-worth, like an innate feeling, not an outcome from a doing or an action. So it's a moving of our locus of attention and awareness away from the outside and what we try to get or do, and more towards the inside and a deeper connection to ourselves. How to do that, of course, is a whole other kind of set of questions and piece. And it is something that we do get into some elements of this quite a bit in the Conscious Transformation course. Yeah, it may be something we come back to at some point in the future. So I'm guessing I'm already way over my usual 10 minutes, but as I say, I didn't track the time before I started. There's a load more questions here, and I will come back and do more of these. I may do another one next week. Feel free to let me know your comments and add to if we could keep the questions on the questions thread rather than adding new questions to this, that will help Jenny locate them. I also noticed that she posted a post in the community group about not restarting the same threads. I think there's been quite a few discussions around CBD oil, and it's better, A, to keep those conversations for legality reasons, in separate CBD groups that are elsewhere on the internet, but also to try to avoid restarting the same conversations, so we can kind of add to conversations that are already going. I think it's a better way of organizing the content there. But below this, please feel free to post your responses to these particular questions, and I'll see how the kind of schedule unfolds. I may do some more, and a part 2 of this next week. Let me know if you enjoyed this, if you'd like more of this format, and I may do something different. I guess we'll see. But I hope that's been useful, and thank you very much for watching.